Hello and welcome to the CPC Certification Review Training with Legacy. This training is designed to assist you in passing the CPC certification exam. This course is not designed for beginners. You should understand the coding process prior to taking this review. Modifier 26 and TC are used in medical billing to indicate the type of service provided by a healthcare provider or facility. Modifier 26 is used to indicate that only the professional component of a service was provided. This means that the physician or other healthcare provider provided a service that only involved their professional expertise, such as interpreting a diagnostic test or performing a medical procedure. Modifier 26 is typically used when the physician does not own the equipment or facility where the service was provided. On the other hand, modifier TC is used to indicate that only the technical component of a service was provided. This means that the service was provided by a facility that owns the equipment, such as a radiology or laboratory facility. This modifier is used when the physician does not interpret the results of the test and only the technical portion of the service was provided. Most radiology codes, including ultrasounds, X-rays, CT scans, magnetic resonance angiography, and magnetic resonance imaging, may be billed with modifier 26 or TC or with no modifier at all, indicating that the provider performed both the professional and technical services. This is known as a global code. Modifier 26 is defined as the professional component, also known as PC, and must be reported in the first modifier field. The PC is outlined as the provider's service, which may include technician supervision, interpretation of results, and a written report. Modifier 26 is used when provider interprets but does not perform the test. On your screen are some appropriate and inappropriate uses for modifier 26. The technical component includes the provision of all equipment, supplies, personnel, and costs related to the performance of the procedure. To claim only the technical portion of the service, append modifier TC or technical component to the appropriate CPT code. This should be placed in the first modifier field. Fees for the technical component are generally reimbursed to the facility or practice that provides or pays for the supplies, equipment, and/or clinical staff, often referred to as technicians. Of note, hospitals are typically exempt from appending modifier TC because it is assumed that the hospital is billing for the technical component portion of any on-site service. Let's look at a clinical scenario provided on the AAPC Knowledge Center. A chest X-ray is performed in a freestanding radiology clinic, and a physician who is not employed by the facility interprets the films. The clinic will append modifier TC to the appropriate chest X-ray code to account for the cost of supplies and staff. The physician who interprets the X-ray submits a claim with modifier 26 appended. The fee for the service will be split, with approximately 60% of the payment allotted for the technical component and 40% for the professional component. Let's look at another example. A physician performs a procedure with a retrograde urography in a hospital. Along with the procedure code, the provider would bill 74420 with modifier 26. The physician uses the urography machine as an aid to help perform the procedure, but since they do not own the machine, they only bill for the professional component. The technical component of service is billed by the hospital. Of course, there are instances when neither of these modifiers is necessary. If a physician performs the retrograde urography in their office and the office owns the machine, then the 74420 would be billed without either modifier. The best question to ask yourself when trying to decide whether to use one of these modifiers is, who owns the equipment? The answer will determine which modifier should be used or if one should be used at all. A global service includes both professional and technical components of a single service. It is identified by reporting the eligible code without modifier 26 or TC. In such cases, the provider is reimbursed for the equipment, supplies, and technical support, as well as the interpretation of the results and the report. When reporting a global service, no modifiers are necessary to receive payment for both components of the service. Here is another clinical scenario provided on the AAPC Knowledge Center. Code 72040, radiological examination, spine, cervical, 2 or 3 views, includes both a technical component and a professional component. If a spinal x-ray is performed at the physician's office, either by a physician or a technician employed by the practice, report 72040 without a modifier because the practice provided both components of the service. When reporting a global service, no modifiers are necessary to receive payment for both components of the service. Do not append modifier 26 if there are dedicated codes to describe only the professional component of a given service. For example, 93010 electrocardiogram, routine ECG with at least 12 leads, interpretation and report only. This code describes only the professional service of interpretation and report. Just as there are codes that describe professional-only services, so are there codes describing technical component-only services. Do not append modifier TC if there is a dedicated code to describe the technical component. For example, 93005 electrocardiogram, tracing only, without interpretation or report. In real-world coding, it would be important to first verify if the code is eligible for the 26 or TC modifier. An indicator of 1 in the PC-TC field on the MFSDB signifies that modifier 26 and TC are valid for the procedure code. Many employers use coding programs that can easily identify this information for the coder, like Codify, Find a Code, or Select Coder. Thank you for joining us for this review. If you would like more details about our intensive CPC training or any of our other training programs, please visit our website at medicalbilco.com.